Good evening. Hmm. Today's presentation is on synthesizing the elements of my study topic. A little bit about myself. My name is S.Stuart. I live in Bangor, Maine, and I graduated from the University of Maine in 2009 with my bachelor's in psychology. I then graduated in 2011 also from the University of Maine with my master's in education in counselor education. Since then, I've been licensed as a clinical professional counselor, licensed as an alcohol and drug counselor, and a certified clinical supervisor. With this, I've been for the last 2.5 years the director of a behavioral health department in a prison setting. So I'm overseeing the treatment of our population of incarcerated folks. Um, Primarily monitoring the delivery of individual therapy, substance use treatment, problem sexual behavior treatment, crisis management, um, and working to make sure that all of our incarcerated individuals have the support that they need um, to gain the skills to be successful when they release. I chose this topic. Of course, a part of that is because I am in mental health. Um, and so something that I've always been interested in is work cultures, specifically looking at some of the team and employee dynamics, as well as how leadership can influence the dynamics of a work culture, and combining that with workplace mental health stigma. Um, so really exploring the perceptions of workplace mental health stigma among mental health professionals specifically. So looking at those that practice in the mental health field, so mental health clinicians, psychologists, psychiatrists, psychiatric nurse practitioners, those sorts of career, um, those specific areas. Looking at folks that either are diagnosed with a mental illness or are not diagnosed with a mental illness, and how they perceive their workplace culture to be around mental illness, specifically for coworkers or for themselves. So what they perceive as the nature of the culture around mental health diagnoses in their workplace. Okay. So some keywords that relate to my topic. So looking again, I had mentioned mental health stigma as being a big piece of this. Also workplace burnout, which is not necessarily does not necessarily mean a person has a mental health diagnosis, but focusing more on kind of when an employee feels like they're just really run down in the workplace. Also looking at support for mental health professionals, um, looking at mental health professionals and workplace stigma, occupational mental illness, employee mental well-being, mental health in the workplace, and mental health professionals with lived experience. Lived experience refers to having a mental health diagnosis. So, mental health professionals that also have a diagnosis of mental illness themselves. So, the definition when I'm referring to workplace mental health stigma is specifically going to be defined for the purposes of my presentation as negative perceptions, prejudice, and discrimination towards individuals with mental health problems within occupational settings. Moving into key information. So digging a little bit into some of the research of what we already know about this topic. In 2018, 452 out of 678 mental health professionals reported experiencing mental illness. So that's a significant amount of individuals um, that they themselves identified as having a diagnosable mental illness. So about 2/3 of the population of people that were working as mental health professionals. In 2016, 75% of 101 mental health professionals reported using mental health services. So what that would be that they either maybe were seeking out a mental health counselor, maybe they were getting prescribed medications for mental illness, either from their primary care provider or from a psychiatrist. And then in 2020, out of 264 mental health professionals, 57% reported having depression, and 11% reported having a substance use disorder. So a substance use disorder would be something where there's some substance. We commonly hear more about alcohol, but it can be any illicit substance as well. So legal or illegal substance, and that their use is causing problems in multiple areas of their life, essentially. Okay, uh, continuing on with more key information. In 2020, a study of 12 United States mental health providers that worked within the US, 75% of them, um, when they disclosed their mental health diagnosis in their workplace, 75% reported indirect prejudice. So this would be more like, overhearing um, negative comments about people with mental illness from peers or from leadership. 25% reported direct discrimination, so they themselves being treated differently as a result of disclosing this diagnosis. And 17% reported direct prejudice, so comments and statements being made to them directly about their diagnosis. One individual was quoted as saying, "I'm scared to death that I would be outed, and next thing you know, my career would be over." So, really, a lot of fear around the possibility of coworkers or leadership, maybe even supervisees finding out about their diagnosis and how that could negatively impact their employment. More key information in 2023, out of 45 working professionals, half of them hid their diagnosis of mental illness from their employer. They had reported that their main reason was fearing that it would damage their workplace reputation. So connects back to what we were just talking about on the previous slide. In 2016, out of 77 mental health professionals, 1/3 of them did not disclose their diagnosis at work. And in 2021, 56 working professionals reported that they actually felt their mental illness was beneficial to their work. And this could just mean that they felt like they were able to better connect with clients because they could relate more to mental illness and understanding where they're coming from. To conclude, some things that I plan to explore and some conclusions that I've come to at this point is that mental health professionals they struggle to seek support at work, not necessarily requesting workplace accommodations for their diagnosis that they may be eligible for. Um, that there can be some negative feelings associated with hiding mental illness from your workplace and your peers. Some areas that I would like to explore. I'd like to know, how do mental health clinicians with or without lived experience perceive workplace mental health stigma? So I'd like to dig a little deeper in what I have already been discussing um, in this presentation, and also looking at team dynamics and the influence of of leadership and that impact within all of that. So thank you for your time, and I hope that my presentation was helpful.